Hello, once again I am here. As I promised you guys, this is going to be about the treatment of smoking, quitting smoking. Quitting smoking. Before we jump into this video, please subscribe and press the bell button. Alright, let's get started. So let's really talk about how to quit smoking. Is it possible to quit? And why should we quit? Yes, it's possible to quit. And the reason you should quit is because imagine all of us are taking some kind of medication on a daily basis. Either it is for anxiety, depression, bipolar, or it could be just for high cholesterol, high blood pressure medication, diabetic medication. So if you are going to be smoking, you're doing injustice to yourself, because the medications that you are taking, you take this medication, but you're not going to get the full efficacy of that dosage that you're taking, and you're not benefiting. Why do this to yourself? Why? So that is one of the reasons why you want to quit. We also spoke about secondhand smoking and the effect from the secondhand smoking for your loved ones and also your family and friends, and to the stranger that you're going to smoke and expose them to this high risk. Do no harm. This is one of the reasons why we should be quitting. Apart from that, if you want to go for a life insurance, your premium is going to be pretty high. Really, I mean it. So all other addictions, you can come out of it and you can have a better life. But smoking cessation is very important. They will test your urine for the metabolite, and that's it. The premium is pretty high. So do yourself a favor. If you're not even planning to quit, this is one of the reasons that you might want to quit, right? There are so many reasons not to smoke. There's only one reason why you want to smoke, because you want to smoke. All right, we spoke about why we shouldn't continue to smoke. So how can I stop smoking? Now, like any other process, we have therapy, we have medication, right? But smoking cessation, quitting is easy, but to stay away from picking up another smoke is not that easy. So you want to not have a relapse for the first 3 months. That's the highest risky time when you start the process of quitting smoking. So now that we know that the first 3 months of you planning to quit is a risky time, you want to support yourself. Supporting yourself through medication is a smart way to do it. There are nicotine replacement therapies. They are called NRTs. So what are they? These are the stuff that you can use over the counter. You don't need a doctor to prescribe most of these, like nicotine gum, nicotine lozenges, and we also have nicotine patches. They even give it to you for free in America. So you can get the nicotine patches, and you can have nicotine inhalers. Some of them are over the counter. We used to have a prescription strength nicotine inhaler, but lately I do not see that insurance covers for that, or it's not even available that frequently. And if at all, if I write that kind of a prescription, it's really like out of pocket. People are paying arm and a leg, but it's only one time that people end up buying it, and after that you don't have to, because by the time you're done with that one pack of nicotine inhaler, you don't go back to smoking. So that's a great benefit of that. So we have all these NRT treatment, and other than that, we also have few medications. Right now, I would say the one that is available is bupropion, which is also called as Wellbutrin. Wellbutrin is excellent for someone who is planning to quit smoking. So other than this, what else can I do, right? Craving is a big thing. As I said, the first 3 months is a risky time. You get cravings and you kind of give yourself into this process of having a relapse. We don't want that. So what can we do? Now that you have picked the date, the first thing is to plan and proceed. So what is the plan? Plan is to find a date, which is 30 days from today, that I'm going to stop smoking. In order to do that, the first thing first, figure out the hierarchy, meaning a morning cigarette is important for me, so I'm not going to think of giving it up. But later during the day, probably I can cut down. Maybe the afternoon after lunch, I can give up the cigarette smoking. But in between my lunch and the dinner, couple of smokes that I go for, I might cut it down to 1. And so that kind of makes it 1 less cigarette. Say if 10 cigarettes a day, now you have 9 cigarettes a day for the first week. You just cut down by 1 cigarette. And then the next week, you kind of, also you can do one more thing, is that buy light cigarettes. So the light ones, that can be interchanged. Instead of the full effect, you get the lighter version. So you have a mix, right? Like the caffeine and the decaf coffee, when you mix it, you can quit drinking coffee, the same concept. So you're going to do the lighter version. So that kind of takes care of your first week. The second week, you try and quit the cigarette that's between morning and between the lunch. If you have 2 cigarette smokes, now you make it like 1. So for the whole day, you would have cut it down to 2 cigarettes per day by week 2. Week 3, you can try to cut it down if you can, 3 cigarettes. So now you're talking about 7 cigarettes a day, which is a huge difference. In fact, when you get to the quit date, you would have cut down by 4 cigarettes. So it'll be 6 cigarettes a day from 10. Huge accomplishment. Even if you couldn't do it, it's okay. Try it. Your mindset, you get ready for that. And then on the quit date, you stop buying cigarette packet and you stop it abruptly. And you use nicotine replacement therapy, the ones that we already talked about. And this is when you're proceeding with your success. First 3 months, remember, it's a high risk. Even if you were to have a relapse, it doesn't matter. It's a slip up. Get back on track. Continue to try to keep away from smoking. So it's just like bicycling. When you learn it, you fall off the bike, you pick yourself up, back pedal up, and then you go moving forward. The same thing. So slip up is inevitable, but if you don't give in, and if you really try, you can make it, and it is worth it. So we have these days, we are reaching up to the quit date. We have already reduced the amount of cigarettes the number of cigarettes per day that we have been using. Now the next step for us is to quit. So after the day comes and we don't buy any more cigarettes, and we try to stay on this medication and the nicotine replacement therapy and continue to keep up. In order to distract yourself, you want to exercise, you want to eat nutritious food, you want to drink more water. And it's also like this addiction, nicotine addiction, is just not for the nicotine alone. The process itself, lighting up the cigarette, putting it on your lip, all these is an addictive process. So you want to replace that with a gum, or you might even use a pen, or you might use something like to just keep it, lollipop, lozenges, try whatever you could to satisfy the urge, right? Apart from that, you also want, as I said, develop some kind of exercise hobbies. So you have some dopamine that you're producing to give that pleasure, to replace this craving, to replace this addiction. And the neuroplasticity will happen and your brain will understand. On top of all these things, in case that you had a relapse, you did smoke. It's not a big deal. Pick up. It's okay. That's just a slip. Don't go back to heavy smoking. Don't beat yourself up. You can do it. It's like bicycling. When you learn to bicycle, you try and you balance, and you think you're balancing, and then you lose your balance. You fall off the cycle, but then you pick yourself up back on the bicycle and pedal. That's pretty much it. Life is that simple. Even quitting smoking is that simple when you don't make it complicated. Listen, the only person who can really help you quit smoking is you. Get that motivation. Say to yourself, I can do this, and I need to do this, and the reasons are. Also, like constantly thinking about what are the consequences. How are you hurting every day other people? How are you hurting yourself? And if you're a female, you can talk about your external beauty and what are you doing to yourself by smoking, right? What are you doing to your fetus if you're pregnant, if you continue to smoke? Also be very mindful about the triggers like coffee and alcohol. Go easy on that, right? So if you're going to quit smoking, you don't want to stack up on coffee now, one addiction to the other. So you do have withdrawal symptoms. You can have irritability, anxiety, and also like lack of energy, headaches. So you can try to take supportive treatment for that. You're not alone. Don't do it alone. Try to get some help online. There's also 1-800-QUIT-NOW, QUIT now, 1-800-QUIT-NOW. Try to make a contact with that number. And also you can find friends, groups. There are apps, smartphone apps these days to quit smoking. Use all these resources and you will be successful. Where there is will, there is way. Thank you. Thank you, friends. I'll come back with a very, very, very interesting topic, which is quite heart-wrenching. In India and also in the United States, we do talk about a lot of women who are being raped, and there are things that people are not understanding about this whole illness. It is paraphilic disorders, and so let's really dive into that topic, and I hope I can make some educational difference in the way we think and the way we understand these illnesses. Why do people rape? Why do we have violent rapes? Why are people addicted to porno? Why are people having hypersexuality? And is it normal? What is normal? What is not normal, right? Please stick around and I will come back with those series of videos because that'll be quite an interesting topic. Until then, thank you.